Hello, my name is Ros Quinlivan. I'm Professor of Neuromuscular Diseases at the National Hospital for Neurology and Neurosurgery in London. I'm going to talk about anaesthesia for adults with Duchenne muscular dystrophy. This is an important topic because anaesthesia carries many risks and causes a lot of anxiety. There are three types of drug that are used to help people when they have a procedure or operation. Firstly, there is something called local anaesthesia. This is an injection that causes the skin or area to be numb so that you don't feel pain. This type of anaesthesia is safe for people with Duchenne muscular dystrophy. General anaesthesia and sedation are used to put people to sleep. Sedation causes light sleep and general anaesthesia causes deep sleep. Both types of treatment are likely to affect your breathing and therefore carry a potential risk. So before you have any operation or procedure that requires general anaesthesia or sedation, it's important that you ask these questions. Firstly, where should my procedure be done? We would recommend that this is always done in a big centre by people who are familiar with looking after adults with Duchenne dystrophy, and there should always be an intensive care unit on site. The second question is, what do I need before the procedure? What needs to happen? Well, it's really important that several weeks before the procedure you have a meeting with the anaesthetist and that there is a very careful and detailed assessment. This will include a sleep study and a review by your respiratory consultant, together with either a cardiac echo and cardiac MRI if possible, and review by your cardiologist. The anaesthetist, respiratory physician and cardiologist must talk to each other and be sure that they are happy for you to undergo the procedure. They also need to take into account whether or not you are taking steroids, because if you are, you will need an emergency steroid regime to cover you for the procedure. It's also important for people who are underweight that they are not fasting for a long period of time, and they may need a glucose infusion during the procedure. What's very important is that before you have any procedure, that there is an open and frank discussion with you about the risks and benefits of that procedure. Finally, if you are going to have an operation, but you've not yet been started on home ventilation, it might be necessary for you to start on BiPAP several weeks before you have your operation. This is so that you can be stabilised immediately after the general anaesthetic. It's important to remember that each person is individual and each individual situation needs to be carefully assessed. So there are no broad rules or guidelines here other than the ones that I've mentioned, and that is that you must always be seen by an experienced team in a centre that knows how to manage adults with Duchenne and where there is an intensive care unit on site, and that the risks and benefits of the procedure are carefully weighed up before you and your consultant can make the decision to go ahead. Thank you very much for listening.